Good afternoon and welcome to our town hall on COVID-19. I'm Dan Shearer, editor of the Green Valley News and the Sahuarita Sun. A big thank you to our presenting sponsor, Pima Pain Care. You can give them and all of our local businesses a shout out during our 2021 Readers Pick Awards. All the information is available on our website. We are joined by Dr. Theresa Cullen. She is the Pima County Public Health Director and she's the local point person for information on the pandemic. Welcome, Dr. Cullen.
Thank you. Thank you for the opportunity.
Can you give us a quick update on where the number stands and where things are looking like overall right now?
Yeah, this is always a great question and the best way to start so we can set the stage for where we are right now. So we are in a time of high transmission of COVID-19. We've been there for a while. We have had periods in the past 18, 22 months where we've had decreased transmission, but right now we're pretty consistently over 150 cases per 100,000. If you think of the county as having 1 million people, a little more than that, but easy to roll up then to about 1,500 cases per week that we're having. We do have some fluctuations. Sometimes we're at 180, sometimes we're at 140. Right now we're at 158 today. About 100% of our transmission is Delta variant. We did have a period a week ago where we saw some of the MU variant. You may have heard about that one, but primarily it's Delta. Our hospital admissions fluctuate. They go up and down. You may have seen some early press this morning talking about the difficulty of rural hospitals getting beds available for them. A lot of that is due to COVID, but some of that is just due to the natural fluctuation we have based on the season and the number of people that are in Tucson. Our hospital beds, however, do remain stretched, and that's kind of consistent with what we're seeing about the difficulty for rural hospitals to be able to transport people. And in addition, we know that we have workforce shortages. You guys are probably aware, I'm sure you've heard about that, for nursing, for respiratory tech, for hospitalists, for intensivists. Those are physicians that just deal with people in the ICU. Not surprising that we're having those given the extent and the really duration of the pandemic. Overall, we're not in a great place. We wish we were in a time of moderate or low transmission. So we continue to make sure that the public health system can respond.
You say hospital admissions are stretched. Is that worrisome at this point, or where are we?
Yeah, well, we follow this every day. So every day we have different degrees of worry. We would love if we had high vacancy of our ICU and our what we call our med surge beds, our pediatric beds. While there is an increased number of pediatric patients with COVID being admitted, our pediatric bed situation seems to be stable. We know that we've had significant problems with what we call offboarding. That means ambulances bringing people to emergency rooms and having to wait a couple hours for there to be a bed in the ER for that patient to be seen. So we do remain concerned. We talk to the state on a fairly regular, almost daily basis about that, and we talk with our hospitals.
Yesterday, you held a press conference where you said, in essence, that herd immunity is no longer what we're reaching for. You say what we want is stability. What exactly does that mean?
Yeah, well, some of this is related to what we've heard about herd immunity, and I myself have talked about it multiple times, is that 50%, 60%, 70%, 75%, blah, blah, blah. And what you've seen is this number constantly growing, right? We haven't ever regressed that number. Instead, what we've said, we need increased number of people to be immunized. And I think when I talk about stability, I'm referring to a high enough vaccination rate that our caseload decreases. I remain consistently concerned when we have a case rate that we're seeing right now. And it's also somewhat easy to, I don't want to say become complacent, but there's a sense, oh, it's always been like this. Well, months ago, it wasn't like this. Months ago, we had rates in the 40 and 50 per 100,000.
What's reality as far as the vaccination rate in Pima County? What can we hope to get to?
Mm-hmm. Yeah, this is such a great question, right? So we're at about, if we look at who can be immunized, which is 12 and over, just because we don't have immunizations available for the younger age group, we're at about 65% full immunity. And what I would say to people is what you need to do is look at the number we have, 65%, and what we're seeing in terms of the hospital and the cases. So I think all of us would conclude what we have right now is inadequate. There's not enough immunizations yet. So what we need to do is move that number up, and our goal would be 85 to 90%. Now, some of that goal is based on what we know. Data reveals that there's probably about perhaps 10 to 15% of people that, regardless of the reason, will elect to not be vaccinated. So we don't want to make ourselves try to do something that we know can't ever happen. But I do believe we could get to 85% immunity, which is actually where I think we need to be.
We asked readers to send in some questions, and by far the topic of biggest interest is the booster shots. Mm-hmm. Give us the rundown on booster shots. Are they necessary? When will they be available? How do I get one?
Yeah, this is a great question too. So let me talk, I'm going to segregate it into two parts. One is those who are immunocompromised and those who aren't, because the immunocompromised, people that fall into one of the categories, have a history of cancer, are on chronic prednisone, other conditions that result in them being considered immunocompromised by the healthcare system. They need a third dose. That's not a booster. Their third dose is to complete their initial series. So if you think about it, your little kid, when you have little kids and they're going to get their tetanus shot, their measles shot, blah, 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 there's a series that they get. For immunocompromised people, we believe they need 3 doses to reach an immunogenic level that is consistent with what the rest of us get with 2 doses. So that they're not getting a booster. It's easy to think it's a booster, right? It's a third shot, but it's not a booster. It's to complete the primary series. Boosters overall are for people not immunocompromised and meet the categories of having completed a full vaccination series initially. J&J 1, Pfizer, and Moderna 2. What we expect to see is sometime this week or next week, the Commission on Immunization Practices, the Committee on Immunization Practices, will look at the data and give some recommendations. Now, you've all heard September 20th. There's been numbers that have been thrown out there in the past. None of us are, at least myself, I'm not hanging my hat on that September 20th one. I think that there will be a need for boosters for non-immunocompromised people. They'll probably end up getting their own booster series. And when will that start? I don't know. And what you know is what we've heard initially is that it may be related to timing. So if you completed your first series 8 months ago, 9 months ago, 10 months ago, that will probably be the trigger for you to get a booster. As it is right now, the good news in Pima County is we are prepared. We will be able to give boosters. We've worked closely with our pharmacies and our healthcare systems, as well as looked at what we have done in the past, how many shots we would have to give every week to make sure we could meet the demand for that. But right now, there's not a recommendation for that booster.
Okay, and so that addresses a key point of confusion that some people are using the term third shot and booster interchangeably, and as you just explained, that is not accurate.
Right. The third shot is to complete the series for immunocompromised. The booster will be a third shot, right? For people that got their primary series, or perhaps a second shot if they got J&J. But it's a booster. So the fact that people are already getting this third shot if they're immunocompromised, and I can tell you in Pima County, we've given about 6,500 people these third shots. Self-identify. We ask that people work closely with their healthcare provider. Sometimes it's difficult to know for yourself if you are considered immunocompromised or not. But there is a difference between the booster that everyone's talking about and the completion of the series for immunocompromised people.
So the September 20th date, when the boosters are going to be available or should be out there, is really not what we should be looking for at this point.
You know what? It's a week away. I wouldn't, and we don't have endorsement from CDC or FDA. And at least from a public health perspective, we really are waiting to see what happens on the Committee on Immunization Practices. And then remember, you'll recall, like for instance, when Pfizer went from an emergency use to full use, there's a review, this committee reviews, and it goes to the FDA and the CDC and everybody looks at it. The reason for that shot is really to ensure that we're making appropriate decisions, because those decisions, as we know, will impact a very significant amount of the population.
So do we need a booster because the shot is wearing off?
Yeah, that's a great question. That's the concern. When we do boosters, it's because your immune system, your immunogenicity that you have seems to be waning. So it never totally wears off, we would assume, but it does get less. And that's what some of the discussion around boosters was really based on what we were seeing in some other countries, not in the US, with people having increased incidence of disease who had been fully vaccinated. While we are seeing that in the US, we're not seeing it to the level that other countries have seen. And I think that that's one reason why there's just a little, I wouldn't call it a hesitation, there's just a time lag right now to make sure that we can fully evaluate what's needed.
So when you say that the shot loses some of its potency over time, are you talking 20%, 80%? Do we know? On the person?
Well, there's always the set and the setting, right? So there's the individual, and then there's the shot in that individual. I think large loss of immune response is not what we're seeing. What we're seeing is a small loss, maybe 10, 20%. And then the other thing, longer term, but it's not being discussed right now, is really if there is new variants, if there are different strains, do we need to have another response to that? And that's what you see with the flu shot every year, right? I mean, people may say, I get a flu shot every year. I got it last year. Why do I need to get it again? And that's because we base not me, but the CDC and the manufacturers base what's in the flu shot on what we're seeing, what kind of influenza is out there in the community.
Okay, are we going to need boosters for our booster?
Yeah, I would not be surprised. I think a part of COVID is here for a while. It's my crystal ball, my lack of my crystal ball. I don't know for how long, but I wouldn't be shocked that if we see immune waning early on, which one could say within the first year, that we may elect to have boosters in the future too.
So in essence, that flu shot we get every year, is that kind of a booster?
Well, it is a booster. If you're over 65, you get the, my friends call it, the extra flu shot, you get a bigger dose of the flu shot. That's because the assumption is that if you're over 65, and this goes back to COVID too, remember, 1A were people in assisted living and long-term care, and it was because the assumption is in those who are older, you get less of an immune response. So it is in some ways a booster, but the other part that the flu shot is a response to what we know was circulating, what kind of flu was circulating. And that's why this whole focus on variants and looking at what we call the sequencing, the genetic sequencing of COVID becomes so important.
If I got a Pfizer shot, do I need a Pfizer booster?
Mm-hmm. Yeah. Lots of people have mixed and matched. You may have heard some people call Pfizer the Gucci vaccine. That's what some of the young kids we talk with say, oh, I want the Gucci vaccine. There's no indication it's a Gucci vaccine, to be clear. The recommendation is that whatever you got for your first shot for Pfizer or Moderna, you get for your first two shots, you get for your third shot. However, lots of people have mixed and matched, and we have no indication that causes a problem. But we would recommend, if you had a choice, you stay with whatever your initial series was.
When it comes to boosters, people aren't talking about J&J just yet. Why is that?
I think the data just isn't in there yet. And we do have the CDC and the FDA sponsoring studies along with the manufacturers to look at that. There's no indication, in my opinion, that there will not be a booster for J&J. I am sure there will be one. The question, Dan, to follow up on what you just asked was, well, should I just go get Pfizer or Moderna because I got J&J? That's still not known. I mean, and once again, there's mixing and matching. And as you can imagine, remember, there's a large honor system going on here. If you're immunocompromised, we let you attest to that. We know that there are people that say, I never got a shot and they already had 2 or 3. First off, I would say there's no indication that anyone should do that right now at all, but we know that people have done that. So I think what will happen with J&J, my guess is the recommendation will be get a second J&J shot. The J&J shot, remember, has the exact same impact in terms of hospitalization in those who are seriously ill as Pfizer and Moderna does.
So at this point, if when boosters become available, if you got Moderna or Pfizer, if you have to mix and match, that's okay. But at this point, you would recommend against anybody who initially had the J&J shot following up with a booster with Moderna and Pfizer, because we don't have the information on that.
Yeah, that's what I would say right now. I do think that there is going to be a recommendation for J&J. And you'll recall J&J got released, that got the emergency use authorization about 70 days after Pfizer and Moderna got it. So if there's a temporal time period, if we're at this 8 to 9 months, you probably shouldn't need to get one right now. Even if you wanted to get Pfizer and Moderna, you're not at that time period where it would be indicated, just because of the delayed release of Johnson & Johnson.
Okay, a breakthrough case is when a vaccinated person gets COVID. What numbers do we have on breakthrough cases, and is anybody in Arizona tracking non-hospitalized breakthrough cases?
Yeah, so we track breakthrough cases, as does the state. Our number of breakthrough cases is based on number immunized and number of people that get COVID, right? Now, there's lots of caveats here. You have to get COVID in a way that we know you have COVID, right? So you have to be tested, or you could tell us you got COVID, but we wouldn't, not that we wouldn't believe you, but we wouldn't include you in the evaluation of breakthrough breakthrough cases. So breakthrough cases right now range anywhere between 0.1% and 0.8%. So less than 1% of people that are immunized have been diagnosed with COVID. Now, the question has been recently, and it was asked by our administrator, and it is important to us in public health, is what number of people that are vaccinated have a breakthrough case that is serious enough that where they end up in the hospital, right? Because it wouldn't be uncommon if you got the flu shot to maybe get a mild case of the flu. I'm sure many of the viewers have had that happen here. We are just in the process of starting to collect that data and do that evaluation. While it would seem that would be easy to do, number of people admitted to the hospital that have been vaccinated versus number that have been unvaccinated, it turns out there's multiple data sets. And we just this morning spent an hour trying to develop the right protocol to look at it. But overall, breakthrough cases in Arizona, in Pima County, are small. I am aware that there does seem to be some geographic difference. So some counties report, some non-Arizona counties report higher breakthrough cases. It's hard to know whether they're testing more, whether their reporting system is different. I don't have a great explanation for that.
But the breakthrough cases probably are a lot higher than is being reported, because if you're vaccinated and you get it again, the chance of you even needing to go to the doctor are very minimal. You're probably just going to tough it out at home and not tell anybody.
Totally, Dan, I totally agree with you. And I also think that you probably think, well, the public health system keeps telling me I'm going to be fine if I'm vaccinated, so I don't really want to spend the time to go get tested, right? Because you have to test for us to know you're a breakthrough case. Right. And it's very similar to what we've seen throughout COVID itself. Remember, there is a proportion of people that are asymptomatic. So you can be vaccinated, have COVID, and be asymptomatic. And we're cognizant of that. So that's why we're a little, we don't want to say, oh, we know that number that have been vaccinated and been diagnosed with COVID, we have a good number for that. Is that reflective of what's going on totally in the community? I'm not sure we know that.
But if you have people who have been vaccinated, they are a breakthrough case, they don't go to the doctor, that would indicate that the vaccine is not as effective as maybe we thought it was.
Yeah, I think that we need to think back on flu, and I'll just trigger flu here a little. No vaccines are 100% effective, and nobody has indicated that they would be. We have high effectiveness rates, but you'll remember 92%, 85%. You've probably heard those numbers before. Mm-hmm. So what that means is 8 to 15% of people are probably going to get get an infection. The critical thing I think here is if you're vaccinated, your odds of having a serious infection, and especially resulting in mortality or death, are very, very small.
Okay, and that's something we can measure and has been measured because those people end up in the hospital.
Right.
Okay.
And we don't want, we never want to falsely reassure people that you won't ever get ill with COVID, but the odds of you having a serious infection due to COVID, for instance, resulting in missing work, missing school, are pretty low.
Okay. Now, the long-term effects from COVID, those who don't just recover in a couple of weeks, what are we seeing as far as this goes?
Yeah, I think we don't know. We know that there are long-term effects. Actually, the University of Arizona is engaged in one of the longest long-term studies that will be conducted in the U.S. They have funding for that. What we've seen things that are very similar with what we've seen in the past with people that have had post-viral characteristics. So things like myalgia, muscle ache, low-grade fever, fatigue, very cognizant, high level of fatigue, some cognitive stuff. You'll recall early on people were talking about being forgetful, about brain fog, not an uncommon picture with some of the viruses that we've had in the past. Some decreased ability to perform physical activity because of fatigue, but also early muscle fatigue, and headaches, that loss of taste and smell can be persistent. I think what we're going to see is over the next maybe 6 to 18 to 24 months, have a really better handle on this. And the other thing we don't know, because I don't want to, I don't want people left in the unknown here. It's not uncommon for bad viral infections to do this. We have a whole thing called post-viral syndrome, not post-COVID viral syndrome, post-viral syndrome. People that have ever heard of some of the chronic fatigue syndromes may be aware a lot of that is related to virus. So our hope is as we learn more, we'll identify which factors or which conditions are due to the COVID itself, and also ways that we can treat that. So for anyone who may be suffering from long COVID, rest assured there's a lot of research going into this area, and there's a real desire to try to figure out what therapeutics as well as other modalities could be available to help reassure you.
We have one reader who wrote in and said that she's been experiencing the effects for 15 months. She's in her 80s. She wants to know if there is any research yet that has found any prevention or medicines to relieve breathing issues or just lack of energy.
I don't know explicitly for that age group, Dan, but I'll follow up on that. We know that there is a subsegment of long COVID that continues to require oxygen. So there's a small group of patients that have become, in a sense, oxygen dependent. The issue is, will that eventually go away? Does exercise help? What we found with chronic fatigue, interesting enough, because it almost seems orthogonal to the disease itself. You're fatigued, and what you're going to have is your doctor saying you need to walk, and you're like, really? I can barely walk. So we do know that there is this impact, a positive impact in many cases with at least limited physical activity, even for those who feel like they can't do it.
You said you said 100% of the cases you believe in Pima County are now the Delta variant, and so obviously the vaccines are effective against this.
Yeah, we think so. So let me caveat that. This past week, so we get weekly reports. This past week, 100% of what was sequenced was Delta. The week before, we had two of our sequences that were MU, which is a variant of interest, not a variant of concern. Delta is a variant of concern. So we do believe that the vast majority of what we're seeing in the county is due to Delta. And then your question is really important, right? If we are giving the vaccine, is it effective against Delta? And we do believe it is effective against Delta. Now, there has been this speculation about Delta Plus, which is another variant of Delta. So we're just going to have to really be very cognizant of the potential of the impact of changing variances.
And then the MU or the MU variant, people were concerned about this initially because it had shown to resistance to the vaccines. Is that still the situation, or is it still being looked at?
You know what, it's still being looked at. And that's actually why it's a variant of interest as opposed to a variant of concern. And that designation is not our designation. It's WHO, CDC. They all get together and decide that. But a variant of concern means we're really worried that there might be more rapid transmission and a higher impact. Obviously, Delta at one point was a variant of interest and it moved to a variant of concern. So I'm not saying MU can't become a variant of concern, but right now it isn't.
Okay, this is from one of our readers. Can COVID-19 or one of the variants be spread by those who are vaccinated?
Yes. So people that are vaccinated can get COVID. And remember, we just talked about that. And if you get diagnosed with COVID, you are a case and you can spread COVID. What we believe is people that are vaccinated have a shortened viral shedding time period, which means that you can spread it, but you're probably only going to spread it perhaps in the first 48 hours as opposed to 96 hours. That number obviously depends on you. It also depends on what kind of immune response you got to the vaccine itself. But it is important to note, people that are vaccinated can become cases. I mean, we diagnose them with COVID and we ask you to isolate. And the reason why we ask you to isolate is so you don't spread the vaccine, so you don't spread COVID.
We're getting a lot of questions about mask wearing and whether it's wise to be out in public right now. Last night, our newspaper hosted an event with 200 people in a venue that can hold 300. Masks were optional. Would you have attended that event?
Not without a mask.
But you would have?
I would have attended, yeah.
Okay.
But I would have worn a mask.
Okay.
And I'm fully vaccinated. So I would say fully vaccinated, wearing a mask, preferably an N95 if you're in an area where there are a closed indoor space. And then what you would hope is that the ventilation is adequate. Ventilation is a key thing. We talk about it a little, but probably not as much as we should.
So then what are the basic rules of safety when it comes to congregating right now?
Well, from a public health perspective, what we put out in August, and we still are by that if you are in a closed indoor space, we're not saying you can't go, but you should be fully vaccinated and wear a mask in that situation. And obviously this whole concept of layered mitigation, don't go if you're sick. If you feel ill at all, leave right away. If you have a fever, don't show up. Be aware that you can transmit virus to other things. And the other thing is, the more that people that are in a space are vaccinated, the less likely there is to have COVID. So a strong recommendation that people that are coming together are fully vaccinated is really important.
This is from a reader. If I'm vaccinated, am I safe? Should I cancel Thanksgiving and that would put me on an airplane, then in contact with relatives who are children? What should this person do about the holidays?
Yeah, this is a really good question. And what I would say is, I don't think that there's a black and white recommendation here. There are some black recommendations, meaning you shouldn't do it. If you're not vaccinated, you shouldn't go. I mean, to me, that's pretty. That's a yes or no. That's a binary question. If you're not vaccinated, you should not get on an airplane. If you are vaccinated, you're on an airplane. There's been some recent studies related to air travel that really show how the decreased ability to transmit COVID occurs in those situations. So you should vaccinate, you should mask. The other caveat, though, to this one is, Dan, the issue about where you're going, right?
Mhm.
So if you're going to a household that's immunocompromised, I wouldn't go. If you're going to a household where there's lots of kids and they're not immunized, but the family itself has practiced good social and layered mitigation, you may be okay. I think the bottom line is there is a risk, and everyone needs to become comfortable with their own risk level. So your important thing is to decrease your risk score. And the way you do that is to vaccinate, mask, mask, mask when you're around others. Obviously, we don't recommend that you need to mask when I go home at night with my husband, I don't mask, right? We're both fully vaccinated. So.
Also from a reader, the CDC recommends we not touch our masks while wearing them. Why is this important, and why is it so universally ignored?
It's so difficult to do, right? It's so difficult to look at me. I'm touching my face. It's really bad to touch your face. You should never do that. I during Ebola, I worked in Sierra Leone. I ran an Ebola treatment unit, and I tell you, we just screamed at each other about touching because it's so easy to touch. I think the statistic is 100 times an hour you touch your face. Mm-hmm. So that's why we recommend it, because when you touch something here and then you touch your face and you have a mask on, you're touching your mask. And so you're potentially contaminating your mask. It's why we recommend to people, I have masks all over my office, that, you do that loops, that you go like this, as opposed to grabbing right here and taking it off. So.
Okay. Ivermectin, what is it and what use does it have against COVID-19?
So ivermectin gets rid of parasites in livestock. Really, really, really effective. COVID-19 is not a parasite. It's a virus, and we're not livestock. So its use in COVID-19, in my opinion, is not. There's no use for it. I want to acknowledge that there were some early preprints that came out. A preprint is a study that gets released that has not undergone what we call peer review. And because there's been such an aggressive need for information about COVID, articles that are written by scientists can come into publication as a preprint. I would caution all the viewers to understand that preprints may not end up being validated once there is a peer review. In the case of ivermectin, there were some preprints that were released that people grabbed on. Kind of understandable, right? Like everybody's grabbing on, there must be some easy solution to this. What therapeutics exist? They've subsequently really been disproven. And as many of your viewers probably know, there's been a lot of reports from the poison centers about toxicity and actually even deaths with ivermectin. We queried some of our pharmacies in Tucson, and we did get back that they were seeing significant increases in the amount of ivermectin that was being prescribed. I would caution viewers that there's nothing right now that indicates that ivermectin is an effective therapeutic for COVID, either prevention or treatment, and you run the risk of having very serious side effects.
So right now, no curative properties that you're aware of?
No, none.
I read this morning in the Minneapolis Star Tribune that there's a clinical trial underway at the University of Minnesota Medical School, and they're evaluating ivermectin and 2 other medications as outpatient treatments to prevent severe COVID. So that'll be something to watch.
Yeah, and I think in that case, Dan, an academic sponsored therapeutic trial, if people were interested in it, that is the way to look at many of the new meds that are being proposed. A lot of the studies, what they do is they just pull meta groups of data together, but they're not controlling for enough things. So you can get what we call a signal that may indicate something's real, and in retrospect, it's not going to be real. And the other thing, I just want to remind people that medications all have side effects. So every medication we have has a potential side effect. Some side effects are much more harmful than others. Ivermectin is really designed for livestock. They weigh a lot more than most humans. And so your dosing is really off, and you just are really easy to get in a toxic range with that medication.
When do we think children are going to get the okay to get the vaccine?
Oh, I wish yesterday, right? I've speculated on this. I've said I really thought it would be September or October as kids went back to school, because there's obviously a really big push because of the schools. I think now it's probably going to be November or December. We hope that it will be sooner, but I wouldn't count on it. And this slide does give you a sense of, thanks for pushing that out there, that we've had only almost 1,900 cases in our schools. Those are cases. Those are COVID proven. 60 outbreaks. I think it's a little higher than that today in schools across the county. We work very, very closely with the schools, the school districts, the public, private, parochial, charter, to make sure that any decisions we make about classroom closures are done in conjunction with them. But we do remain very concerned about, especially the 5 through 11, right? Because they can't vaccinate. Any kid that's in school that's 12 and over, we would strongly encourage to seek vaccination.
But are children more resistant to COVID-19 than adults?
I don't think so. I don't think they're more resistant. What we do see, what we thought we saw all along was less serious illness. I think we are seeing tremendous increases in the number of kids with COVID. It's possible some of that is just due to the fact that we're testing more kids 19 and younger, probably because their parents are more aware, they're in school, blah, blah, blah. But we are starting to see a number of children that are ending up in the ICU. And that had been the major thing we wanted to avoid. I do think kids they're not more resistant, but they do seem to tolerate the virus a little better than adults do. And, for all of you that have had children or have grandchildren, you know this, right? That those first years when kids start going back to school, you probably remember preschool, kindergarten, it feels like everybody's sick every day. And that's just because there's all this virus stuff and they're all just passing it around. So.
Okay. And I want to go back to that 1,900 figure. So 1,900 cases in the schools currently. And to be completely thorough on our stats, the fact is an overwhelming percentage of those have recovered and they're back in school.
Oh, the vast majority. So this 1,900 cases is since school started. You'll recall one of our districts started in mid-July. So we're about 2 months. Remember, and our schools start earlier than many other schools in the country. We're about 2 months into the school year. For many schools, we're a month into the school year. 1,900 since we started, 60 outbreaks since we started. We have a team that all they do is work closely with the schools. And I want to reassure your viewers, we don't declare an outbreak or close a classroom unless we have a strong belief that this is critical. Just so everyone knows, we have not closed any schools. We have closed some classrooms, but we've done that in conjunction with the teacher, the principal, and most of the times the superintendent of the school. We are the ones that make that decision. The schools are not making that decision. It is our responsibility. If there are questions, they come to us, but we do that in conjunction with the school because we need the school to tell us a little bit about the classroom, right? Is there good airflow? Is there not? Are the kids moving around? Are they masked? Blah, blah, blah.
Reader question. They're pushing so hard to lock down, mask, and vaccinate people for a virus that has a recovery rate of more than 97%.
Yeah.
I bet you hear that a lot.
We do hear that a lot. I would, and I don't know if you can throw that. that slide up, there's been 2,500 deaths in Pima County that are due to COVID. There are many concerns about long COVID, which you already asked me about. And so I think it's important to note that this is not without consequences. And the transmission rate is pretty high. You will recall early on in Pima County, we had a very high rate of mortality in our older population who have now been subsequently immunized. I will say that I think there will be a time when somebody asks me that question and I can go, yeah, we're okay because people are immunized. But
another reader, right. Okay. Another reader question. Can PCR tests distinguish between the flu and COVID?
This is a great question. PCR is a way that we use to diagnose flu. It's not the same PCR. Well, PCR is polymerase chain reaction. So it's the same process, but a test for PCR for COVID is not testing for flu. So if you've got tested for COVID, don't assume you've been tested for flu. There is a PCR test available that can test for influenza A and B and COVID, but the vast majority of tests that are being used right now for PCR are just testing for COVID.
And if you've had the COVID shot, it's okay to get a flu vaccination also this year.
Yes, we would encourage you to get the flu shot, and you can get the COVID vaccine and flu shots together. So if you are someone who has not gotten a COVID shot or you're getting your second COVID shot, please go ahead and get a flu shot. We would recommend you do that. We do know that many of the pharmacies are offering that right now. Our county-sponsored sites for COVID vaccination are not offering flu shots right now, though we will be offering flu shots soon.
Okay, another question from a reader. There's a documented sharp drop in flu cases since COVID arrived. Some people believe flu is being misdiagnosed as COVID. Why have the flu numbers dropped?
Well, we think the flu numbers dropped primarily because people masked and there was this layered mitigation. Remember, respiratory protection. You'll recall the flu about please cough into your shoulder. And many people don't do that. They just cough into the air. What we believe happened with influenza, at least, is that the reason for the decreased numbers was due to the fact that people had more respiratory protection. The one thing we should talk about is RSV. Our RSV numbers have not dropped in our kids. Actually, our RSV numbers are the highest they've been in a couple of years right now. We're working closely with the state to determine that. Some of us, including myself, were like, well, is this just a variation because we're testing? More kids are going to the doctor, so they might be getting tested. No, it does appear that there is a true increase in RSV in the community. But for influenza, we believe that there was a true decrease. It wasn't misdiagnosis, and it was because of the respiratory protection.
There are a lot of people out there who are misinformed or perhaps underinformed about COVID. Where is the best place to get reliable information on what's going on?
Well, I would say if you're in Pima County, our website is really good. We have a FAQ site that we update on a regular basis. We actually have a full-time librarian who's working with us, and she works also with health literacy to make sure that if we see a new question coming in from the community, we answer it. We're really pretty up to date. Usually within 24 to 48 hours, we've put more information there. For those of you who want to go to a medical source, I usually just defer people to the Mayo site. Mayo tends to be doing some of the best information out there for individuals. And there are also the National Library of Medicine has a lot of information, but it tends to be a little more technical and scientific based.
The CDC is getting an awful lot of criticism. People just don't trust them anymore. Briefly assess how you think they have done since the outbreak of the pandemic.
I think the pandemic has been really difficult for public health and clinical services. And the recent data is disconcerting. About 50% of people trust the CDC. You'll recall in the past, there's been a higher trust ratio. There's only about 40% of people trust local or state health departments, which is really disconcerting. I can tell you what I think contributes to that. And it's the fact that we change our minds. That instead of people realizing that what we are is on a continuum with increasing science information, and we're actually really not changing our minds, what we're doing is making better decisions based on information that has become available to us. But it is disconcerting. We need people to trust that there's not politics in what we do. And I can say this because I work for Pima County. Obviously, I serve at I think I'm a county employee. I serve at the pleasure of whatever the county board of supervisors is. But the board doesn't tell me what to say. They don't call me up and say you shouldn't say that. They call me if and when they do to get information. So I would argue, at least for Pima County, we really, from a public health department, we function as an independent department. We are able to make our own conclusions when we make recommendations while we ensure that our administration is aware of them. Those recommendations are being based on the best data that we have available to them. I also need to reassure people that doesn't mean that in 3 weeks we won't change a recommendation, right? Because if there's better information that comes along, what you would want from us is to be able to respond.
Okay, we're going to bring in Kevin Murphy. He oversees the neighbor site for the Green Valley News and the Sahuarita Sun. Kevin, have we had any questions come in from readers during the course of the conversation today with Dr. Cullen that we should address?
Hi, Dan. While we've covered most of the questions I'm seeing here on social media, I do have one question here for Dr. Cullen that I don't believe that we've addressed yet, and excuse me if we have. So Holly on Facebook asked, do we know the impact of the vaccine on unborn children? And have any women who have been vaccinated experienced side effects after giving birth or during giving birth?
You know what? This is Kevin. This is a great question because I'm going to take this as an opportunity to make sure people know that the vaccine is totally safe in pregnancy. Early on, it was understandable even to me if I had been in my first trimester of pregnancy. Do I really want to take this vaccine? There were very, very few women who were pregnant in the original studies, and when they were in there, it was unintentional, right? People that didn't know that they were pregnant. The American College of OBGYN has come out very, very strongly, and I support this recommendation that if you are pregnant, you should get immunized. What we do know is that there's protection for the unborn baby. Breastfeeding as well as being immunized during your pregnancy offer antibody flow to the child, so to the infant, so the infant is protected from that. In terms of side effects, we're not seeing any different side effect profile with pregnancy and or women that are lactating breastfeeding moms than any other people. So, many people have a side effect from the vaccine. They get a sore arm, may feel a little myalgia, a little muscle ache, may have a little fever. But by and large, there's no indication that pregnancy itself or getting the vaccine while you are breastfeeding increases your risk of side effects.
Okay, thank you for answering that, Dr. Cullen. And if any of our viewers have additional questions regarding COVID-19, head over to the Green Valley News and Sahuarita Sun neighbor website. You can post your questions there. We'll research your questions and get back to you as soon as we can. And so with that, I'll send it back to you, Dan.
Thank you. Well, we're nearing the end of our time. Thank you, Dr. Cullen. This is great information, and we have enjoyed the time with you very much.
Yeah, thank you guys. I'm really glad when you invite us to come be a part of this, and we've been able to reassure people that we're doing everything we can right now, and your role is to please get vaccinated if you're not.
Very good. Well, we will have a recording of this town hall on our newspaper websites and on Neighbor. As Kevin said, that's the place where Green Valley and Sahuarita go to hold their community conversations. There's a link to that site on our website. We will also have all of this information in our print edition on Sunday and online before then. So thanks again to Pima Pain Care, our presenting sponsor. We really appreciate their support here. Also, we hope that you have a great rest of your day. Thank you for joining us.